Thank you, and great opportunity. Thank you for the GSBI team and for this opportunity. My name is James Kiumbe, Director of Business Operations at Jacaranda Health. Jacaranda Health's mission is to reduce maternal and neonatal mortality in Kenya. Can you imagine having 250,000 women and 1 million children dying during childbirth? Well, that happens every year in Africa. Maternal mortality rate is quite high and stands at 488 per 100,000 live births. And access to quality healthcare is still a great barrier. And some of the barriers to care include cost, transport, and respect when offering the care and decision making in terms of where to deliver and the kind of service that needs to be and the kind of service that needs to be sought. The clients are typical peri-urban women who are casual laborers who have delivered their last child in a private facility, who believes in quality of medical services in her area is poor, person who saves for medical expenses and pays roughly about 3,000 shillings in rent and has some form of, and doesn't have any bank account and uses mobile transfer money, M-Pesa, commonly known in Kenya, on her mobile. Can you imagine it's only 44% of deliveries that are attended by skilled health workers in Kenya? Kenya has approximately 44 million people, out of which 10 million are females of reproductive age. Growth rate is at 2.75%. The health expenditure stands at 4.5% of GDP. In the market we play in, our clients have different alternatives that include government facilities, private clinics and hospitals, traditional birth attendants, and some even deliver at home, which is very risky, and rarely are skilled health workers involved. Our value proposition is to offer high-quality, patient-centered maternal and neonatal care at a fifth of cost of other private hospitals. And we are tracking this. We believe that it's doable. And currently, for a quality delivery, we're charging about $100, 7,900 Kenya shillings, which is quite affordable to our clients. We believe in offering affordable quality care. And to be able to do this, we've integrated clinical and health to make sure that Jacaranda is sustainable. We integrate patient-centered care and quality excellence, and any client who comes to our door leaves with a smile. Over the last 1.5 years, we've had more than 500 deliveries, more than 2,000 clients have come for antenatal services. We've had 0 maternal mortality, and we've had only 1 neonatal mortality in the more than 500 deliveries that we've had, compared to 44 neonatal mortalities per 1,000 live births in Kenya. Some of our enablers is that there is great demand for quality service. The quality aspect is misunderstood. You'll find people saying that they want quality service, and what they mean by quality is probably respect. It's they can feel on the facility. It's the kind of how they are handled. There is high population growth rate, and there is high publicity of need to curb maternal and neonatal mortality. And we've had the Kenyan First Lady take up a great initiative called Beyond Zero to help reduce this. Some of the obstacles that we face include free delivery services in government institutions. And here free is in quotes because still they are chargeable costs that people end up paying. But the perception that's created is that the service is free. There's a lot of bureaucracy in getting national health insurance fund accreditation that would open doors for us to be able to have access to insurance companies and factory workers. The process of recruiting clinical staff is slow, and when they come at times, the turnover is high. Our business model. Our revenue sources are the services that we deliver. That includes normal cesarean deliveries, postnatal and child wellness visits, antenatal clinic visits, family planning services, and we've had partners who've given us grants to be able to bridge the gap between when a clinic opens and when a clinic breaks even. Our value chain. And here we just bucket in three phases, and we generate demand through a network of community health workers who go to our catchment area and have a touch with the community, with the people within our catchment areas, and explain services that Jacaranda offers. From the data that we've gotten, we normally do a lot of trend analysis to understand our clients better, to understand what are their needs. We call them when they have visited and just get feedback to help improve our services. As a result of this trend analysis, we found quite some great barriers that we were facing in our first clinic. And in the second clinic, we've addressed most of them. The recruitment of our staff is a key component of what we do. The onboarding process, the training that we take them through to help them be able to administer the different tasks that they have, whether at the clinic level or at the support level. The services that we offer are maternal and childcare related, which include antenatal, as said earlier, postnatal and child wellness, family planning and delivery. All these services are paid for, so we charge for all the services that we offer. We anticipate that a clinic will take 3 years to break even, and will require 110 deliveries per month to be able to break even. Each of our clinic has a capacity of 150 deliveries per month. Some of our critical factors include opening a third clinic, serving over 10,000 clients, and we're looking at improving maternal health behaviors and quality of care and costs. And to help us do this, we want to see how we can work towards reducing the amount that is spent on each high-quality delivery to $90. We want to attain level 5 accreditation rating for safe care, which is a quality, which is for quality. And we want more than 70% of our antenatal clients to get at least 3 ANC visits. We are also sowing seeds of partnership and influence, and we look forward to at least managing 2 obstetric facilities and to partner with government facilities to improve maternal care. Some of our scale and impact targets include being able to, at a facility level, each clinic being able to break even within 3 years of operation, and to have at least 70% cost recovery per clinic at year 2. This will help us be able to track on a month, on a quarterly, on a yearly basis. And we want to have less than 45% of our total cost being staff costs. The resources and impact. 70% of antenatal clients to attend more than 3 clinics visits, and we want to have more than 90% bed occupancy rates. Some of the outcomes that we anticipate include having more than 150 new antenatal clients per month, 130 live deliveries per month, and to have at least 10% of antenatal clients being referred by other facilities. This will diversify our channels and be able to tap into other channels that we've not had before. We have a robust team of management team spearheaded by our team leader, Nick Pearson, myself, who handles the business operations, Faith Muigai, who handles the clinical operations piece. And the emphasis on quality is quite great for us, and we've brought in Eric Washira, who is a Lean Six Sigma black belt, trained and has a wealth of experience in telecommunications, healthcare, and aviation. This management team is complemented by advisors and board members, including top Kenya obstetricians, global maternal health experts, and investors who have built global organizations. We are offering safe, cost-effective maternal health care. We've had 100 deliveries so far. That shows the trust that people have in us. We've had 0 maternal mortality, and we've had only 1 neonatal mortality in the more than 500 live births that we've had. We're seeking a grant of $150,000 to help us offset operational costs as we strive to reach the delivery target of 110 per month and be able to break even in the second clinic. Join us and be part of this great team that is helping change and shape maternal and neonatal landscape. Thank you.